Hi, I'm Dr. Bornstein. Today I'm going to talk about allergy. I want to talk about what is an allergy, what causes you to have allergies, how do you diagnose them, and then how do you treat them. So the first thing I want to talk about are the two types of allergies. One is seasonal and one is perennial. A seasonal allergy is when you are allergic to something that blooms at a particular time of year. So that would be if you're allergic to pollen or a tree or a grass. That's going to happen. It's going to last 2-3 months and it's going to go away, and then it'll happen again the next season. A perennial allergy is when you're allergic to something all year round. So that would be something like dust mites or animal dander like cats or dogs or mold. So what does it mean when you have an allergy? When you have an allergy, it means when you're exposed to whatever it is you're allergic to, your body releases something called histamines. And if you take histamine, which you can bottle, it's actually used in skin tests, which we'll get into a little bit later. But if you take histamine and you put it in your nose, you'll get a runny nose. If you take histamine, you put it in your eyes, you'll get watery, itchy eyes. And if you take histamine and you put it on your skin, you're going to develop hives. So histamine is a substance that's in a cell in our body called a mast cell, M-A-S-T. And I kind of drew a little picture here of a mast cell with histamine inside of it. So what does it mean when you're allergic to something? It means that on your mast cell, to simplify a little bit, you have a receptor for that allergen. So I'm going to draw a picture. Okay. So this person is allergic to pollen. They have a pollen receptor on their mast cell. So now they're exposed to pollen, and pollen attaches to that receptor, and then the mast cell breaks open, and all that histamine just goes flying through the body. And if you get that histamine again in your nose, runny nose, eyes, itchy eyes, skin, hives. So that is what it means when you have an allergy. So how do you diagnose an allergy? Well, there's lab tests you can use, or there's just by symptoms. So if you are around a cat and break out in hives, you know you're allergic to cat. If you eat a strawberry and get an itchy mouth, swollen tongue, you know you're allergic to strawberry. You don't have to do a test for that. You know to avoid those things. But if you're uncertain, you just walk outside and you're allergic to something, you don't know what it is, and it's something you think you might be able to avoid, you can do one of two different types of tests. You can do a blood test or you can do a skin test. The blood test is called a RAST, and a test for these antibodies in your body called IgE that shows that you're allergic to that. So you can do a blood test to check for that. A skin test is where you put a huge grid on your back, and the allergist usually does this, and they take extract of all these different things: cats, dogs, trees, grasses, mold, everything, and they put a little drop on your back on one of those grids, and they scratch it. And if a hive develops, then you're allergic to that, and they grade the hives 1, 2, 3, and 4 plus. 4 plus, you're very allergic to it. They also give you a little bit of histamine and scratch your skin just to make sure you can develop a hive, to make sure the test is going to be accurate. Generally, I don't do testing unless we're going to be ready to get allergy injections, but some people do want to do the testing just to see what they're allergic to, and that's fine as well. I usually start testing around 2 years old. So now, how do we treat? All right, so I go through a series of different medicines leading up to allergy injections. So I'm going to go through that. The first thing I use when someone has an allergy is an antihistamine. So I like to use what they call second generation antihistamines. Those are antihistamines that don't make you drowsy. The drug does not cross over the blood-brain barrier. And the second generation antihistamines would be like Zyrtec, which is cetirizine, Claritin, loratadine, Allegra, fexofenadine, the newer ones, Zysol and Clarinex. So those are usually first line for me. I like those better than Benadryl just on a daily basis, because Benadryl can cause you to become very drowsy. So I'll start with that. And if that fails, the second thing I'll do is either what's called an anti-leukotriene called Singulair, or the generic is Montelukast, or I'll do a steroid nasal spray. And depending on the symptoms, I'll choose one or the other as my second line. The way that Singulair works is it stabilizes the cell wall of the mast cell. So going back to my incredibly artistic picture here, you have your mast cell. You get the circle there, the cell wall. And you take Singulair and your cell wall thickens. Thicker. So now when the pollen attaches, it maybe doesn't break open and doesn't do this. So it tries to block the allergic reaction, sort of the cascade of events right at the beginning, where you're not even going to get the release of the histamine. What the antihistamine does is it tries to block the attachment of the histamine to the endpoint. So you take the, say, Zyrtec, and the histamine maybe doesn't get into your nose, or it gets blocked at your nose, or blocked at your eyes, or blocked in your lungs or on your skin. So the Singulair blocks the release, and then the antihistamine blocks the attachment. And then lastly is the nasal steroid, and what that does, if one of your symptoms is a runny nose, congestion, that will decrease the inflammation in the nasal passage. When I look up someone's nose who has allergies, the skin, the mucous membranes in the nose turn extremely white and very swollen. And what the nasal steroid will do, it'll decrease that swelling so you can breathe easier. Also, if you have itchy, watery eyes, there are eye antihistamines that you can use as well, that you drop in your eye, and it's an antihistamine directly for your eye. So if someone comes into my office and they have itchy, watery eyes, runny, stuffy nose, maybe a little bit of a cough, I put them on Zyrtec, I put them on Singulair, I put them on Flonase, I put them on an eye drop, and they're still suffering, then the next step is allergy injections. So to do an allergy injection, you really need to know what you're allergic to, because you're going to be getting injections for the very specific thing that you're allergic to. And so for that, I like to have skin testing done. So let's say we do skin testing and it turns out you're allergic to tree nuts and oak. So now the allergist will create a serum that's a liquid that has tree nuts and oak in each liquid, and you would get 2 injections, one for tree nut, one for oak. And what the injections are is they're little tiny bits, like a 1/10,000th solution of what it is you're actually allergic to. So you get a little injection of that under the skin, and then a week later you get a little bit higher concentration, and then a week later a little bit higher concentration. And slowly but surely you're desensitizing yourself to what it is you're allergic to the point where you're getting injections of the higher concentrations of those things you're allergic to, and you're having no reaction at all. And so that's the basic outline of what is an allergy, why do you get them, and how do you test for them, and how do you treat them. If there's anything else you'd like to hear about, any subjects that you're curious to hear about, please email my office at office@pediatriccentre.com, and I'd be happy to do a video on that. Thank you very much.